Joining us in our newsroom, we have Dr. Jennifer Carnahan. She is a research scientist at the Regenstrief Institute. Dr. Carnahan, welcome.
Thank you. It's so nice to be here.
So we're talking about a new research paper that you had come out, published, that addresses how to help patients that are formerly or are being discharged from nursing homes or long-term care facilities, and they're making their way back home. I imagine that this isn't an easy transition for either the patient or the caregiver. So first you say the first few days are crucial to prevent adverse events. What could happen in this time? What kind of adverse events are we talking about here?
Sure. So to really recognize the potential adverse events, we have to think about the situation of the patient and the caregiver. You know, usually they've been in the hospital due to an acute illness and then needed extended rehabilitation in the nursing facility. And so, you know, while older adults are certainly very resilient, at that time, they're vulnerable to bad outcomes. And so when they go home, they need to be able to resume life at home, resume the medical care that they need without interruptions. And we found that many of them experienced interruptions. They were not able to continue with the therapy that they had been receiving prior. They maybe didn't have their new medications available to them, so they just went back to taking the medicines they were taking before they were in the hospital, which often those change when you become acutely ill. And so we realized that time, right when they get home, we really have to make sure that they have all of the resources they need in order to have a successful transition home.
And you were speaking about just now the medication situation, the physical therapy might start to slide a little bit, not having access to that every day. So a patient can actually regress maybe when this transition happens, and that's definitely not what we want. And give me a severe case. Give me an example of perhaps a severe case of what could happen if things are not addressed. Because they're being discharged, that doesn't mean that they're completely healthy. There's some, we're just discharging to, we're just going home, that we're healthy enough to go home.
Right, yeah, they're certainly often not back to normal. So in our study, 3/4 of the people we interviewed actually had home health care ordered for them, which is an extension of the care they had been receiving before, in order to help support them when they go home. And, you know, so when there's interruptions in that care, that's when we start to have problems. A severe outcome of this could be having to go back into the hospital or return to the nursing home, or even become long-term residents of nursing facilities if they're not able to maintain their lives at home.
Certainly, we don't want them to have to go back to a care facility. What kind of information and support do the patients and the caregivers need to make the transition smooth? Do they need education, pamphlets, in-person counseling, support groups? And given COVID-19, why would this be especially important?
So to answer your first question, it's funny because the people who we spoke to actually had huge piles of paper that they were given when they left the hospital and also when they left the nursing facility. One of the problems was it was difficult for them to access the information they needed. It was almost like information overload for them. And so really being able to target and direct them to exactly what they need for their unique situation would really help with that transition. When we think about COVID-19, that has just made all of these issues so much more difficult for patients and their caregivers to deal with. A lot of times, you know, if a facility is having an outbreak, even if the patient themselves does not, you know, have COVID-19, they may have to limit the caregiver coming into the facility. And everybody knows that a face-to-face interaction is just so much more valuable. And so, you know, ordinarily we would have caregivers come into the facility, we'd talk to them about what we're planning, we'd hand them the medication list, you know, we do all of this in person. And now a lot of this is being done over the phone or virtually. And that can be really difficult to take all those potential gaps and close them. And so, COVID-19 is just exacerbating what is already a pretty difficult situation for some people.
And last 30 seconds, what else would you like to add?
Well, I think one thing that we found that we hadn't really appreciated before is that a lot of these folks had been away from home for more than a month. And so if you're a caregiver to somebody who's been in a skilled nursing facility and is heading back home, or if you know someone, a neighbor, just appreciate that they have not been in their normal environment or their habitat for such a long time, and we need to really support them and be patient and gentle with them as they're trying to reintegrate themselves into their lives at home.
Well, Dr. Carnahan, thank you. Well, congratulations on your paper, and thank you for sharing your knowledge with us.
Thank you so much.